Right, so today we're going to be talking about some of the advantages of online therapy as opposed to face therapy. Some of them are advantages and could be better than in person therapy, depending on the person. So, what are they? First of all, the most obvious one is convenience. The patient, the client, doesn't need to get dressed up, doesn't need to travel to a psychotherapist's office, get in the car, use petrol. And something you may not have thought about is it's also convenient for the therapist who doesn't need to go to an office and doesn't need to see you in a flustered state having gone through traffic and all that sort of thing. And the therapist doesn't have to dress up either. A lot of online therapists that I've seen work in shorts and a t-shirt. So there is a big convenience factor both for the client as well as for the therapist. Number two is an interesting one, and it's got to do with focus and attention. When you come to therapy, whether that be as a couple or a group or as an individual, which is the most common, it's a social experience. We sit in a room, in a way, having a chat as we might do over a cup of tea. There are extraneous social niceties involved. Now, some of them are deliberate and are contained in a therapeutic situation anyway, but there is a bit more of it when we're sitting face to face in an office, or as in my case, my rooms are a bit like a lounge. So there are fewer distractions when we're working online. There's a little less fluff, if you like, and a lot more attention is given on both sides. One of my original objections to online therapy before COVID was that I thought I needed, as the therapist, to be in the presence of my client in order to make proper observations. And then I discovered through COVID, when we had to work online, that online work, including playing telephone work, heightened my attention-giving skills. I had to pay more attention. I couldn't see if a client was in tears on the other side of the line. I had to be alert for it, notice it, even if I couldn't see it. Even silly, minor little things like a client's breathing on the other side of the phone. These are cues that I'm used to seeing in a face-to-face situation. So in some ways, online therapy provides for a greater acuity rather than less noticeabilities. Third advantage of online therapy over face-to-face therapy is that if you're sick, and I've seen this so many times, if you're sick or if you've broken a leg, or if you're in a wheelchair and in some way incapacitated, well, you do online therapy from your home, or in some cases even from your hospital ward. You don't have to go through the whole drama of getting to the therapist. You don't have to present yourself in my offices. The fourth one, and this is also an interesting one, is the effectiveness of online therapy. Many studies have been done, especially as a result of the COVID phenomenon, where we had to work more online. A lot of studies were done into gauging and comparing the effectiveness of online therapy as opposed to face-to-face therapy. I'm aware of about 60 odd studies, and they all show that online therapy can be equally effective. And this is a big plus. This was one of my fears before COVID, namely that wouldn't be as effective. Well, now we know that it is, and it has been studied and shown to be the case. A fifth advantage is for the therapist himself or herself, in that, as I mentioned before, we don't have to have an office. We could be working online from a beach for that matter. But it means that the therapist has greater mobility. I travel a lot. Instead of cancelling or postponing appointments with my clients, I can take my clients with me. I spend a lot of time working from Southeast Asia. Now I don't have to tell a client, I'm going to be away for 2 weeks, I can't see you. I can see you, and I do. So the continuity of the therapeutic process isn't interrupted. And the therapist is able to be mobile. It's an there are advantages for the client, obviously, as well as for the therapist. A sixth benefit is simply privacy. A lot of people still feel the stigma of seeing a therapist, a psychologist, a psychiatrist, and just don't like going to a therapist's office, being seen to be in need of a therapist. Well, when we're working online, no one knows. So it takes away, for a small number of patients, that angst. The seventh one is a cultural one. Almost everything that we do these days happens online. Parents bring their children to me often thinking that their children have communication problems because they spend so much time socializing using their phones. Because in my day, we didn't have these things. And 20 years ago, parents relied on normal social intercourse. People met with people. Nowadays, the default norm for interpersonal communication, whether we like it or not, has largely become online, using phones, messaging services. And so the culture of communication has changed, again, whether you like it or not. I don't like it personally. I think we're losing out on a lot of human communication skills. But culturally, where we are at in the 21st century is an online experience of most things. Face it, you do your shopping, all sorts of things online these days. So it is quite normal, I think, culturally, for us to be engaging even in things like therapy online. Thanks, I hope you found that interesting.